Why everyone is getting type 2 diabetes nowadays so earlier? That because of the genetics we are getting diabetes, but is there anything else that we can intervene? Yes, there are reasons. Bizarre food habit, not properly sleeping, lack of physical exercises, more of a mental stress. Intermittent fasting is very good for diabetes. At least we should take 6 to 8 hours of sleep, exercise, which is very important part, as we should eat every day, sleep every day, we should exercise every day. So got a patient with a complaining of urine infection 2 days back, a young lady around the age around 20. So why she was getting that continuous urine infection? To evaluate that, we got to know that she is having diabetes. To evaluate why she is having diabetes, we got to know that she is having type 2 of diabetes. So as we know, there are multiple types of diabetes, but the more common is type 2. But the surprising fact is why everyone is getting type 2 diabetes nowadays so earlier. Is there something we can do? Is there something that has changed which is predisposing the diabetes earlier? Yes, genetic, we can say that because of the genetics we are getting diabetes, but is there anything else that we can intervene? Yes, there are reasons. First, we can see that lifestyle, our bizarre food habit, not properly sleeping, lack of physical exercises, more of a mental stress. Okay, so if we come to that point by point, first thing that I want to emphasize on diet. Nowadays, maximum of us are not having properly home cooked meal, or we are having meal that is processed and ultra processed. So few things that we have to include and we have to exclude for the diabetes. One thing is high protein. We have to increase our protein intake. Second thing is carbohydrate. We should reduce simple carbohydrate, like we can reduce rice, white rice, and in spite of that, we can substitute that with a brown rice or semi-polished rice, or we can go ahead with millets. We can go ahead with atta, multigrains, okay, which is again should not be a simple one, okay, which should have a more fiber. Second thing is that along with the food, we have to, like, along with the carbohydrate and protein, we have to give more important for the fiber also. So much more of a fiber. If we take our plate, the 50% should be fiber, 25% should be carbohydrate, and the 25% should be protein. So there are, we'll talk about some other day regarding the protein, how much and what. So this should be mostly about the plate sizes or food sizes. Now next come how often we should eat, when we should eat. Again, it depends on person to person, but mostly eating windows should be something around 10 hours, and the fasting windows should be around 12 to 14 hours. Initially to start with 12 hours, then we can progress to 14 to 16, or extended fasting which can be more than 17 hours. So intermittent fasting is very good for diabetes, not only diabetes, for metabolic diseases like PCODs, fatty livers, and other things than diet. Second thing is stress level. So to reduce the stress, there are so many books that we can study. We can take a brisk walking, we can do meditation. So it's better to practice at least 15 minutes of meditation morning or in the evening time. Third, sleep. At least we should take 6 to 8 hours of sleep. Again, sleep is not for person that mandatory for everyone 6 to 8 hours. So when we are sleeping, waking up in the morning and not feeling tired, we are energetic, not feeling like we want to sleep again. So that's the time you should understand that your sleep is complete. Now, third comes exercise, which is very important part, not only for diabetes, not only for metabolic symptoms, for each on and every one of us, for our daily living. As we should eat every day, sleep every day, we should exercise every day. So for the exercises, for beginners, it's better to start with at least basic walking, brisk walking or normal walking. But I should say, some people they will walk for 45 minutes and then they will whole day they will rest. More than that, it's better that you take a walk for 20 minutes after each meal, maybe around 30 minutes after you have your food. walk for 20 minutes, morning, afternoon, and night, 3 times. That should be fine. Okay. And other things that you have to, so diet, our exercises, stress level, so meditation will help for that, intermittent fasting, this should be helpful. So these are a basic thing that we can control, and this can help reducing our sugar level a lot, and this can help postponing our onset of diabetes. So the age that people are getting in earlier age, if we can follow all these things, we can delay the progress of diabetes for a few years. Okay, that is what we call it as a reversal or postponement of diabetes. Okay, so and we probably further we will discuss about this in much more details slowly. And after the diabetes onset, we should not think so much that we got diabetes, we get stressed about it, we get panicked about it, and we run around back of the dietitian, run around back of the like doctors and all. Better than that, yes, if you get a disease, there should be some solution for that. And is it a lifelong, what type of disease, for that definitely better to go ahead with a doctor or physician and consult them properly, not like taking your own medication, or not like following your own diet. Yes, diabetes is going to stay for you, you have to live with it, but we should live happily with it.